Hey everyone, my name is Melissa Ortiz. You can call me Mo. I am from New York, and I guess you could tell by the accent. I am a licensed veterinary technician, and I am the practice manager at the Center for Avian and Exotic Medicine on the Upper West Side of Manhattan, right outside of Central Park. That's a nice plug in case anybody wants to come visit us. I have been in the field for just a little under 30 years, and I've spent my entire career focusing on exotic companion animals as well as zoo and wildlife. So I'm very excited to be able to give this presentation today, and I am thanking AZVN for your support as well as the support of Kerrier Beads, because this is the treatment plan that I would like to go over with you all today as a resolution for some of these very stubborn abscesses that we're treating in practice. So thank you for joining me today. This lecture is treating abscesses with a local antibiotic delivery system. And here we go. Some things we're going to discuss in this short time together are getting to know and understand abscesses in rabbits or small mammals, traditional treatments that have been used historically to handle abscesses, but also introduce you to the Kerrier Local Antibiotic Delivery System, and show you the ease and efficacy of using this as a treatment option in your patients. So let's get into it. Abscesses and some of these common exotics. Um, They're one of the most common medical presentations that we see in practice. Now, these are going to be from either dental or auricular origin. Can also be from trauma or wounds if there's a little scuffle that happens with a conspecific. Foreign material that is getting either into the skin and burrowing itself, or we've also seen let's say like a chew toy, if there's a splinter that breaks off and gets in between some teeth and decides to nestle down into the gum line, this is also another area of concern. And post-surgical complications. Abscesses can form after a procedure or after trying to debride an abscess. If you're not getting everything out, there's a really high chance of that reoccurring. I'm going to skirt through this slide quickly because I feel like we have already discussed numerous times how much these infections are almost impermeable by antibiotics and how we really need to be safe with what antibiotics we're choosing to treat these infections when it comes to abscesses. We can't talk treatments without throwing in a nod to medical grade honey. This has really become popular over the last several years, and for good reason. It's pretty easy to get your hands on, a little bit on the pricey side. Should not be used as the only treatment. Should really be incorporated into your treatment plan after some sort of surgical method has already been used to try to reduce or remove that abscess. It has very good broad spectrum antibacterial properties. Does not have a tendency to build microbial resistance, and also promotes healing, granulation, and decreases inflammation of affected tissue. So all good stuff so far. I think the only downside would be it's kind of messy and you still need some sort of surgical intervention. All right, now we're getting into the cool stuff. Let's talk about PMMA beads. And that is, if I say it incorrectly, it's just from the New York accent. The polymethyl methacrylate beads are kind of a thing of the past. This was the first, when I first started working with exotics, this was the first antibiotic impregnated bead system that you heard about. And what I remember most about it is this horrid smell that would come like a really strong nail polish remover type of aroma. So toxic to work with. They offer a localized delivery of antibiotics. However, because of the compound that this is made from, which is really like an acrylic plastic type material, not biodegradable, has to be removed. So you're looking at a second procedure that's not cost effective for a lot of owners. You're increasing risk to the patient by requiring a second anesthetic procedure. I went right to the cons first, only because after using these for so many years, it was amazing that you had this invention to be able to bring antibiotics right to the source of the infection. But it was just all the aftercare afterwards that made this very cumbersome. And it was hard to convince owners that once they committed to the placement procedure, they would also have to commit to the removal procedure as well. But the exciting part is that we still have a localized delivery system for antibiotic beads. They are 100% absorbable. This was a game changer. And here is where I would like to introduce Kerrier. I attended an exotics conference here in the States in 2024. And when I saw that there was a lecture being given about antibiotic impregnated beads, I could not wait to run over to the table. And Jesse from Kerrier can attest to this, because I promised that man, we're going to get to talking, and once you've got my interest, you're feeding me all of this information. I'm going to be like a stray cat. You're not going to be able to get rid of me. So it's been over a year. He's visited New York. We talk frequently. He is very, very proactive in making sure that we are successful in using these bead kits here at my clinic, and I could not be happier. The fact that this was fixed a safety issue and was a one and done procedure is what really drew me in, because immediately I thought of the prospect of client compliance and just minimizing risk to my patient, because that is something every nurse, every technician, every doctor wants. So this kit is very, very easy to do. There will be some videos following where you get to see myself and my team members making an entire kit of beads for you all. And I think the entire process took at least like 10 minutes. And the curing time can be anywhere from like 15 minutes to 60 minutes. This can totally be done in your practice. You set yourself up in a nice, sterile little area. Yeah, it was incredible. And there's what I have here on this slide is there was a study, which if you visit Kerrier's website, I included it later on, you're going to be able to see just chock full of information that they give to you with all the studies and research that have gone into showing the efficacy of these beads. So just really incredible, and I am so excited to share with you how it's been successful for us so far at this practice. It's important to mention the actual efficacy of these beads. So one of the studies that was produced was a comparison of antimicrobial activity using zones of inhibition produced by the antibiotics that were infused into the calcium sulfate beads. And this study was performed at 0, 3, 6, 9, and 12-month intervals, where they were able to test just to see how effective these antibiotic beads are at keeping infection away, is the most layman term that I could describe that. So the result that they found was when these beads are stored properly, meaning protected from light, and at room temperature, they are stable for up to 12 months. In vitro activity is not impaired thanks to these demonstrations. So this was a very cool study to show that even if you have these stored 10 months after you made them, they are still effective to place in your patients. So very exciting. So not only is the website for Kerrier very, very good at providing webinars, literature, information on the how-to guidelines, setting times, different antibiotics that you can use, and what formulations you need them in, either powder or liquid. The website is just beyond incredible. But the information that comes packaged with each kit is also substantial. When Jesse was here and we opened up a demo kit together, we were able to make an entire bead kit for the very first time with no hiccups on our first run. So it was very impressive. Every single kit comes with the mold that you see right here on the screen. It comes with a sterile solution for mixing, sterile mixing bowl. Everything is set. The only thing you will need is if you're using an injectable formulation of an antibiotic, have somebody on standby who can help you draw up the medication sterilely and then insert it into your mixing bowl, or be able to hand you the powdered formulation of an antibiotic, which if there is a compounding pharmacy near you, speak to your pharmacist, because we have a couple here that are local to us and they were very excited that we're using this bead system, and they do sell us antibiotics at our request in a powdered formulation so that we can go ahead and use it with the Kerrier kit. So hopefully there's no hiccups in these videos playing for you all, but again, I made these with one of my hospital assistants just to demonstrate the ease of the entire process of this kit. And it was a video showing how we did the entire mixing and smearing it into the little tray, and then the video picked up again once the curing time was over to show you how we were able to remove them from the mold and what we used to store them properly.
Or Mo, and this is my hospital assistant, soon to be vet tech, Chris. We're coming from the Center for Avian and Exotic Medicine all the way in New York City. Woo-hoo. We are making this video to demonstrate just how easy it is to set up your Kerrier bead antibiotic kit, and we're going to walk you through the steps today. So we have a few things. We already opened up one of the kits, and I want to show you everything that's inside. You get this portion, which is all of the mixing ingredients or your tools that you need. We are not going to open this yet because this is also going to dub as our sterile field. General product information. This is chock full of information coming right from their website as well. They are very informative. There's lots of literature as well as instructional videos and webinars for you to watch, including this one. We then have the most important part, which is your mixing instructions. From here, you're going to choose the antibiotic. What we're going to be making today is gentamicin. You want a total volume of 4 mils, so we're going to use 4 mils of gentamicin mixed with the mixing powder, and all of these instructions are very well spelled out in the kit instructions. So we're looking at gentamicin. The mixing technique is going to be standard for liquid antibiotics as opposed to powdered antibiotics, and the set time is going to be 15 minutes. This is why we're doing this as a demonstration today, so that'll be a quick video. The second pouch just so that there's not too much product in the way, we'll get rid of that. And here's everything we will be working with. We have a mixing bowl. We have a little spatula. This is as close to cooking as I get, folks. My mom could never see this video. We have the silicone mold, and it gives you the option to make either 3mm beads or 5mm beads. You have 4 mils of sterile mixing solution, because if you use 2 mils of your liquid antibiotic, you need to supplement with the sterile mixing solution to give you a total volume of 4 mils to use the standard mixing technique with liquids. Next, we have our sterile powder. So, according to the instructions, the first thing we need to do is empty the sterile powder in its entirety into the mixing bowl. I really feel like I'm cooking. This is amazing. Welcome to Mo's Kitchen. Mo's Kerrier Kitchen. That's the first step. Now, Mr. Chris, if for me, please, sir. Stabilize my hand. Man, this is trust right here. I'm taking 4 mils of gentamicin. We've got 4 mils right there. Adding this directly to the mixing bowl. And just in case it's not standard, let me just announce what I'm actually using here. This is gentamicin, and the strength on that is 100 milligrams per ml. So we just put 400 milligrams of gentamicin in there. I'm gonna set that down. This is all still sterile, so I'm gonna give this a nice mix. It kind of gets to a pancake batter consistency rather quickly. I don't know how well you guys can see that there. And again, I say pancake batter. This is coming from the person who does not cook. So this is a nice spackle material here. That I do. And it's already clumped up pretty easily. This is the whole jar of mixing powder with the 4 mils. And look at that nice little bloop. It almost looks like icing consistency, actually. I want cupcakes. We just had lunch. We're gonna get cupcakes. Okay, this is the fun part. You now take this and smear across the silicone based on what size you want to make. I start in the middle because I make a batch of 3 and 5 millimeter beads at the same time. So, good, you just 5, 6 rows of the 3 millimeter filled very, very well. You can hear the air being released as you push it. And now our sterile beads that are now infused with gentamicin are ready for us to transfer into their sterile storage containers. We're using white top tubes because there's no additives, and I have fresh sterile gloves on. I'm going to take the silicone tray, and as you can see, they're done. I'm going to take a little bit of the spillage on the side to give it a good squeeze. This is a good consistency. It's like a little bit crackly. This is a good consistency. So that's the consistency I want my beads to be at. Not so soft that I could squish them. They're just perfect. So it's because I made them. I cook these. This is what they're gonna come out looking like. Empty a whole bunch of them into here. It's easy to tell the 5 and 3 millimeter apart. What we do is, while we're waiting for this to set, we pre-label them. We put the name of the antibiotic and the strength. So these tubes are labeled gentamicin, 100 milligrams per mil. I put my initials on there so we know who made them. I put the date that we made them, and then I am also putting the size of the bead, because if we're in a rush and somebody's just grabbing a vial, they may not just look at the size and just say, okay, these are the 3 millimeter. So we just label everything really well. Okay, and there we go. We've got all of the beads out. This is one-time use. This kit is one-time use. So we set that on the side. And now, Chris, would you mind opening the 5 millimeter vial for me? The wonder I have, as soon as I finish filling this little jar, let's see. Okay, I am going to now, I will change into some new sterile gloves because I just want to show you all. This is about how much I fill it, because this entire tube is now going to possibly go into one abscess site, which is wonderful. So again, Chris, if you don't mind, thank you. Not that I'm sterile anymore. I won't touch the beads now until I change my gloves. This is what our little storage container looks like. And we store our beads in surgery because that's where we'll be using them. We got this little storage unit where each drawer is labeled with the different antibiotic, and it's also labeled the strength of the antibiotic. And on the inside are the 3 and 5 millimeter beads, so that you can grab the correct size for your patient in the middle of your procedure. So yeah, very simple. This whole process, if you do count the 15 minutes that it took to set, under a half an hour. So thank you so much for watching this video.
Okay. This slide is incredible to me because, again, when I met Kerrier back in 2024, I then attended the lecture that was given during the conference, and this was the most impactful slide to me. Reason being, let me grab this little thing again. Okay, so you're going to see that this is serial documentation of, I believe these were CT scans or RADs, I forget, of an abscess, and they followed this from January to February to March and then April. This is the same patient, and they fortunately had a client that was willing to let them do the follow-up imaging because it's pertinent to be able to collect information like this for efficacy. So this abscess, here it is. You could see that it also had some bony penetration. The recommendation is to jam-pack these beads into the surgical site because they're going to live there. They're going to live there. They're going to be activated there. They're going to dissolve there. And you can see the dissolving beads in subsequent weeks. And by the last image in the series, you could see that there was also bone restoration, which was phenomenal. This meant so much to me to see this because as a former zoo technician, a lot of times when you get your hands on some of those creatures, it has to be a one and done procedure. It is a really, really big effort and a very risky effort to be able to sedate and in that hands on it. That may make a lot of curators shy away from allowing veterinarians to perform a procedure like this within a zoo. So I had to, because I love giving credit where credit is due, which is why I was asked to do this presentation today. I also put Kerrier in touch with the Zoo Technician Association here in the States because a lot of the times it's the support staff and the technicians that are really pushing for patient advocacy and finding a way that we can do something a bit better and a little bit more risk adverse for our patients. So this was wonderful being able to see the progress in a domestic species to be able to have a curator be a little bit more trusting when you suggest a newer therapy. So Kerrier, again, the website is wonderful. There's a lot of articles, there's a lot of webinars. I strongly suggest you look them up and spend some time learning from their website. It was very easy to convince the leadership team above me to be able to bring this product into the hospital because each kit is really intended to be used per patient. But we're able to split it up because we're dealing with just exotics here. So the chances of an entire kit being used in one rabbit abscess or one guinea pig abscess, we might get 2 to 3 uses out of it, if not more. And this is super, super cost efficient for us. It's a way of bringing in new revenue for the hospital. And from a practice manager standpoint, things that I'm learning are when you're requesting new treatments, new drugs, new equipment, you want to be able to speak to your leadership about how do you get that return on investment. These are priced very, very reasonably. And if you can treat 2 to 3 patients for every kit that you receive, you'll be able to get your money's worth in return within at least 4 patients. 2 patients, maybe even if you're pricing accordingly. So it was a very easy sell to my leadership to be able to get this in. And we, since 2025, I want to say maybe we got started getting these kits in by right before the new year. We have a minimum of 18 to 27 patients that we actively have placed this antibiotic bead system in. And the follow-up has been spotty, truth be told. So what we had tried to do is make up a serial imaging package for them to sell along with the placement of the beads. So if they're going to allow us to surgically assess the abscess and then treat it with Kerrier beads, we then give them a discounted package to be able to come back for 30-day, 60-day, 90-day imaging, because we're trying to stay in alignment with the other studies that Kerrier has produced. So we haven't been 100% successful in convincing every owner to allow us to do that. And I'm kind of okay with that, because my main goal is I want to get the very best treatment for these pets. And right now, Kerrier really seems to be it. I think I'm just at time now, but I do just want to conclude by saying Kerrier has really changed the way we treat abscesses. We feel more confident when we go over surgical estimates with our clients, because we're letting them know that the surgery itself is a treatment. However, because these beads are living there inside of where the abscess once was, we have confidence that their pet is receiving prolonged treatment weeks, months after that abscess has been removed. It's really helped us give more confidence to our owners when they're making decisions on how to treat these. And the staff absolutely loves that this is kind of a one and done scenario, and we're not re-sedating, re-anesthetizing patients just a few weeks after. It's very, very easy to go ahead and make these beads, and you have quite a bit of options with the ranges of different antibiotics that you can use. What I should have mentioned earlier is what we do specifically here in this clinic is we will reach quite often for chloramphenicol for an oral antibiotic in treating abscesses in rabbits. However, since this bead system, we've been able to use chloramphenicol, and that has been wonderful because it seems to be a heavy hitter, and in putting them in the beads, we're not seeing adverse effects, GI effects in our patients. It goes after gram-positive and gram-negative bacteria, as well as aerobic and anaerobic bacteria. So that has been the main antibiotic of choice for us here in this clinic when we're making our bead kits. So again, just thank you so very much for giving me this opportunity. I am most grateful to AZVEN for having patience with me and for inviting me to do this. Kerrier, thank you so much for your support. Jesse, you've been wonderful. This treatment method has been a game changer for us, and it's almost a no-brainer. So thank you very much, everyone, and hopefully I get to visit with you all in person in the future. Take care.